Hello, everyone, and welcome. My name is Alejandra Lomensain. I'm here with my colleague, Yasin Khan, and this is part 2 of our training. Just to remind you, we are with the Labor Occupational Health Program, which is part of the University of California School of Public Health, and our mission is to promote safe, healthy, and just workplaces, and to build the capacity of workers and work organizations so that they can take action for improved working conditions. So to remind you, if you haven't seen part 1, it's really helpful to watch that first since we're building on that today. Our agenda for today, we will cover how to recognize hazards. So hazards are things that can hurt you or make you sick in the workplace. So how do you know what those are? And second, we are going to talk about what are the most protective solutions. So what can you do about these hazards? And if you're going to ask for changes in your workplace, which ones should you ask for? Which ones will protect you the most? And lastly, we're going to cover what your rights are as a worker for health and safety. All right, so let's dive in. Let's talk about how you recognize hazards in the workplace. So there's different categories of hazards, and some are more visible than others. So that's why I want to make sure to kind of think about all the different types of hazards that could hurt you or make you sick at work. So the first category is safety hazards. These are hazards that usually they have a very immediate kind of cause and effect. They're usually very visible. It's very obvious what happened. So examples are, things that can burn you, or sharp objects that can, cut you or poke you, fire, things that you can trip over, and also kind of clutter, for example. And then things like, a slippery floor or something that could make you fall. The second category are biological hazards. So biological is, what it sounds like. It's something that's alive. So, right now we're all seeing the coronavirus as a really prominent example. There's other viruses, of course, and communicable diseases. And it can also include things like pests, cockroaches, rats, that kind of thing, and then mold, which, you could breathe in and then it's harmful to you. The next category are chemical hazards. So this can include things like cleaning products is very common. The type of cleaning products right now that are, very much in everyone's minds are kind of bleach and disinfectants. But there's others, such as pesticides and, a lot of others depending on the kind of work task that you're doing in the industry. And lastly, there's a lot of other workplace factors. Stress is very common. So that could be because of like poor management. It could be because of an unreasonable workload or work pace, discrimination, harassment, which you also see here, violence even. And it can also be things like, working in the heat, working in the cold, working in a noisy environment, working in a way that can hurt your body because that's ergonomics injury. So that does include things where, you're doing very repetitive tasks, or you're lifting heavy weights, or you're in a really uncomfortable and awkward position. And so all those things cause you pain. So it's a whole host of things. And so when you look at all of these categories together, people tend to think about the safety hazards because they're very visible, but sometimes some of the biological and the chemical hazards and the others are things that you may not see the effect right away. So for example, maybe you're working with a chemical and, it's not making your eyes water, it's not making you cough, you're not really reacting to it. But in the long term, if you're working this chemical for months or years, then it can have effects in, your internal organs and your systems. So the same thing with stress, and the same thing with ergonomics. It may be something that over time it starts to harm you. So we want you to keep an eye out for it before you start to feel those effects.
Okay, thank you, Alejandra. So now we're going to move into applying those hazard categories to thinking about actual workplaces. So in this example, we see a restaurant kitchen. And if we think about all of those different hazard categories of things that could hurt you right away, things that might hurt you um, in the long term, like those ergonomic issues or stress that Alejandra was just mentioning, what hazards do we see in this picture?
Well, one thing that stands out to me is, you can tell because of it's a kitchen and there's lots of hot things. So it looks like there's heat coming from the oven and the grills and even that thing that's kind of steaming on the stove. I would
Absolutely.
imagine that makes it really hard for workers. Not just that they can burn themselves, but then, they're working in the heat, which is really hard on the body.
Absolutely. And then also this hot grease over here.
Mm.
Looks dangerous.
Yeah, especially since he's not really, his hands aren't covered.
Right,
Or her
absolutely.
hands.
Yeah, their hands aren't covered. And then also like the kind of ergonomic strain, right? Also that you were just talking about, if this is their job over and over again, if we're thinking about ergonomics also, this looks like a pretty awkward box that this person is lifting and putting on a really high shelf. And from here, it looks like these other shelves might be empty. And so it would have a quick fix, maybe if that person could just keep the boxes on a lower shelf that's more in line, so that if their arms could stay at a 90-degree angle, that would be a lot easier on their body.
Yeah, that's true. Yeah, and then I'm seeing right next to that person, there's the ones that are helping the customers. And whenever you're dealing with the public, you could be getting viruses. You could also be dealing with harassment and workplace violence. The customers are upset for some reason and they take it out on those workers. And they're standing. If they're standing all day, that's a hazard too.
Right, absolutely. The standing, the stress of dealing with customers. Over here, we've got someone working with a knife. So again, ergonomics could be an issue of doing this. There is also a knife just like sitting on the side. We're kind of talking about clutter. We definitely don't want clutter or like sharp clutter that could hurt people. And then I'm noticing this big wet spot on the floor, which could definitely be a trip hazard. And then it looks like also this fry grease might be puddling on the ground, which again can cause slips and falls.
Yeah, the other thing that caught my eye is those chemicals that are stored under the sink. They don't really seem to have a label. So I know that, chemicals can be a hazard, and especially if you're not even sure what they are, how to use them safely, how to mix them, how to dilute them, what kind of PPE you need when you're using them.
Right, absolutely. That's such an important point. If you don't even know what's in there, how do you know how to interact with it safely?
Right.
Absolutely. Okay, great. Thanks. Do you have anything else you want to add on to this picture?
No, I think we caught a lot of them.
I think so too. Okay, so I'm going to clear this drawing and then now let's go to the next one, which is a grocery store. So let's see here.
Well, we were talking about knives, and I see a big old knife, and I also see a box cutter. And they're not wearing, also protection on their hands. And they're also in a kind of in an awkward position, both of them. The meat cutter, he's kind of in the little edge because the machine is taking up all the room. So he's kind of, twisted and uncomfortable, his movement. And then the one that's kneeling is also hunched over, not comfortable.
Yeah, absolutely. And then talking about awkward postures, if we look back here, this person who's stocking shelves looks like they're having to bend down really low to pick up these cans, and all the cans are just kind of scattered on the floor. So that seems like a clutter issue and an ergonomic issue. And same here, that these boxes are just kind of in the aisles. So thinking about like if there were customers kind of trying to get through the store, or other workers as well. Like there's another worker right here who also is carrying something that looks really heavy and big, and now there's not really any space for this person to kind of keep walking through the aisle here.
Yeah, I see that. I'm also noticing that slice or the machine And it doesn't look like it has a guard on it. So it seems like the person who's working there could also risk having their fingers get it, caught in it.
Absolutely. Yeah, that could be a huge issue. Those look that blade actually looks extremely close.
Yes.
And then here again, we've got chemicals. Looks like this one has some kind of label on it. We're not sure about these ones underneath, but again, like you mentioned in our previous example, all of those chemicals need to be labeled, and employees need to have training on what they are, how to use them safely. They need PPE. If there's a, if they should have gloves or a mask in order to use these chemicals safely, that's something that their employer would need to tell them about.
Right. Yeah.
Okay, great. Anything else before we move on to our last picture?
No, let's go to the next one.
Okay, great. Okay, so now for this next one, we are looking at some workers that are outside. Looks like landscapers. The first thing that pops out to me here is the sun. If anyone's ever worked outside, can be extremely dangerous, right? Uncomfortable if you get dehydrated. Heat exhaustion is such a big issue, especially here in California. Fortunately, people die, agricultural workers and outdoor workers, every year from heat exposure and heat exhaustion. So that is a big one.
Yeah, that's true. And they don't seem to have, hats on, and they don't seem to have like a shade structure or water nearby.
Right.
So the heat is definitely going to be affecting them. I'm also thinking about working outdoors. We talked about biological hazards. There could be all kinds of animals. There could be bees or ants or ticks or, what have you.
Right.
So that comes with the territory. And then also something you can't see, but I would wonder about is if there's any chemicals. Sometimes there's pesticides or sprays that are on some of this, like the shrubbery or the plants. So
Right, absolutely. Also talking again about these awkward postures, we got a bunch of folks that are crouching and kind of working in ways that look pretty awkward. And then another issue is just that, again, just like the grocery store example, everybody is working really close together, right? So we've got this weed whacker, we've got people are doing lots of different kinds of tasks really close to each other. So then there's a lot of crowding, right? And so if we could set up this workspace a little bit differently, so maybe things are timed out or people aren't kind of there isn't like machinery going by and people reaching down on the ground all next to each other.
yeah, that's a great point. And even the guy who's holding the weed whacker, he doesn't have any goggles or gloves, so he himself is not protected, and then he's possibly putting others at risk because he's so close to them.
Right, absolutely. Absolutely. And then when you use a weed whacker, of course, like stuff flies everywhere.
Yes.
You definitely want to have protection. And then speaking of that as well, like when we were talking about the pesticides or kind of any sort of treatment, nobody's wearing any gloves here either.
Yeah.
Yeah, okay, great. So now we are going to talk about how to address these hazards that we just listed a bunch of different kinds of hazards, different hazard categories. So now we're going to talk about how to address those hazards to make the workplace safer. So to do this, we are going to talk about the example of a slippery floor. So this is a really common hazard in lots of different kinds of workplaces. We saw it in our restaurant example in two different instances. We had kind of some water on the floor, and then it looked like also like the person who was working on the fries, there was some grease on the floor too. So if we think about how we could address a slippery hazard in a workplace, what are some things that come to mind?
I think what I see the most is eventually someone will come and put up a sign, like a caution sign, or sometimes it's a cone, but some kind of marker to let people know to be careful nearby.
Sure, that there's a spill on the ground.
Right.
Another option might be to call like a janitor maybe to come and clean up the mess or to clean up the spill. Um, Sometimes I know when I worked in a restaurant, we had these mats that had holes in them. So non-slip mats. So that might be an option.
Yeah, and then if it's something that's happening often, that's kind of part of that work area, people might even choose to wear non-slip shoes that have a good grip.
Sure, absolutely. Yeah, definitely. And then if it's a situation that you were mentioning where it's like it's something that's happening really often, there might also be an opportunity to think about what is causing the issue and solve that. So to kind of find the root cause of the slippery floor. So there might be like a leak, or it could be from like the grease, kind of always falling on the floor in the same spot.
Yeah, sometimes you can get kind of a little shield that catches some of the drips so they don't end up on the floor.
Okay, great. Great. So now to kind of help us think through, oh, let me see here. Let me turn this off. There we go. I don't know how to take away this annotation. There we go. Okay. So now, if we have listed out all of these potential ideas for how we can handle the slippery floor, but not all of those ideas that we came up with are equally good, right? Some of those ideas will be more protective, more helpful for the workers, and some of them are going to be less helpful for the workers. So the way that we like to think about this is in terms of a bullseye. So like if you've ever played darts, when you are playing darts, you want to get the most points if you can get your dart into this red area here. So in the same way, if you are thinking about eliminating hazards, the best thing that you can do, the thing that you would get like the most points for, is to eliminate the hazard altogether. So if you think about it, if we can eliminate the hazard, then we're making the workplace safer for everyone, and we're not kind of relying on people to remember that they need to wear PPE or to kind of reach out to another person, that we can just solve the issue and then everyone who's in that space can be safer from it. The next best option is that we can create some policies and procedures to keep workers safer. So we're gonna go through some examples based on our slippery floor in just a second of what that might look like. But a policy would be like having a rule in place. And the reason that this is a little bit less effective than eliminating the hazard is because the hazard is still there, and we have to kind of rely on someone to kind of know what the rule is and to be able to follow the rule. So sometimes there are some barriers. And then the least effective option is going to be personal protective equipment, or sometimes what we call PPE. And so that is going to be something that workers wear on their bodies. So that would be like goggles, or like it might be like hearing, like kind of something to protect your ears if you're working in a really loud environment, or gloves, or like special shoes might be an option for that. And again, so for PPE, this is the least effective, but it is still important, especially if it's like the only thing that's being used. So personal protective equipment can be helpful, but it's going to be the least effective option for a lot of different reasons. So Alejandra, can you think of some reasons why it might be the least effective?
Well, I think what I hear a lot from workers is that there's not enough equipment, or it doesn't fit right, or it's uncomfortable, or sometimes people don't wear it because it's just hard to do the job, or it makes you hot, or it makes it hard to talk, or for whatever, they have actually really good reasons why they don't wear it. And then some people want to wear it, but their employer charges them for it, or doesn't make it available, or it's provided but it doesn't last them long enough because then it's in bad condition. So it just seems like it just goes wrong in a lot of ways.
Absolutely, absolutely. Thanks for those examples. Yeah, and I think it's really similar with the policies and procedures, right? There might be like a really great policy on paper, but in reality, good reasons why it's really difficult to follow that policy, and why it's kind of not happening in the way that it was kind of intended to. Uh, so now,
And sometimes people don't even know the policy because they weren't really trained on it.
exactly. That's another issue. So now so this is another picture of our bullseye here, and we are just going to type into the different kind of rings of our bullseye to see what kind of apply the brainstorm that we had created before. So if we start with the best option that we could come up with for removing the hazard, what do you think would go in this kind of category?
Well, it seems that to actually remove the hazard, it would be the fixing the leak, which you had mentioned.
Mm-hmm.
Or maybe if you had that kind of the guard, that catches the leak, catching the leak, we could say,
Yeah,
that would solve it too, because then it wouldn't make it to the floor.
absolutely. Yeah, so I think that is really the key here of like, what can we do to stop the liquid, the water or the grease from making it to the floor? If we're able to do that, then we've eliminated this hazard.
Right.
Great. And so then what might some policies and procedures be to
Well, I was thinking about having, like, you had the calling the janitor or calling someone to, mop it up. And it seems like there's a lot of policies and procedures involved in that, because first of all, you have to have the policy that you have adequate, staffing for a janitor, for example.
Mm-hmm.
In a lot of places they don't, or that if it's someone else, that you've trained that person. And you've identified the process, like how do you call them if they're not right there, are they able to leave whatever other duty they're doing to deal with this situation, etc.
Mm-hmm. Right, absolutely. So that kind of, this idea of like, oh, just call someone to clean it up. It might sound simple kind of at first, but there are all of these issues that you mentioned, right? Like, is there a janitor on staff? Is that person so busy that they can't come right away to clean up this particular spill? If there's spills everywhere, right? How is this person, or all these, if there's a staffing issue, then how can this person kind of catch everything, right?
And also, how much of a priority is it? Because it may be that if there's not a janitor that's just assigned to that, right? And so you're supposed to call a certain person, and that person is ringing up people at the cashiers, doing something else. Do they drop everything and go do it? And if not, then how long is that puddle sitting there? So there's also the policy of how quickly you're supposed to deal with it. And if it doesn't happen right away, then there's a chance that someone will have slipped by the time they can make it.
Yeah, absolutely. Absolutely. The time factor is a huge issue. What about the sign that you mentioned? This is something that we see all the time in stores and stuff, that there'll be a little sign that says like, wet floor, be careful. How effective do you think that is?
Well, I think there's, if we're thinking of what can go wrong, there's just a few different things that can go wrong. You have the thing of someone has to identify that a sign is needed, and then they have to know where to get the sign. Um,
Hmm.
they have to have time to go do it because, again, they may feel pressure that, they have something else they're supposed to be doing at the same time. And then, they have to do it pretty quickly so that, someone doesn't go into the puddle without seeing what's happening.
Right, absolutely. Another thing I think about with these signs too is that they're not at eye level, right? And so
Mm.
if I'm walking and I'm like looking up at my typical eye level, I might walk into the sign, and I might not notice that it's there, right? And so I think that's something that is helpful to keep in mind as well. Is just that that whatever solutions we're putting into practice, that they aren't kind of creating new issues that then kind of also need to be solved.
Yeah, that's a great point. And it may be that there's some, small sign or small cone, but someone needs to go through that part of the floor and they have to do it anyway. So because the
Right.
problem is still there, with or without the sign, someone could still, step in it.
Yeah, absolutely. Okay, and so now if we're talking about personal protective equipment, what ideas would you have for this section for a slippery
Well, we had the shoes, the non-slip shoes.
floor? Non-slip shoes. Um, yeah, I think
And
that's
that reminds me too, we had the idea of the non-slip mat. And so that would actually
right.
remove the hazard. So we can put it there.
Absolutely. I'm running out of space on here. Write it. Non-slip mat. Great. Thank you for remembering that. Yeah, so with a non-slip mat, I think sometimes um, folks can get a little confused about the non-slip mat and where that belongs. So why would you put it in remove the hazard versus any of these other categories?
Yeah, that's a good question. Well, we know it's not PPE because it's not something you wear on your body. And
Mhm.
then if it's the right kind of mat that actually prevents slipping, then you're removing the hazard, right? Because it's not possible to get a slippery floor anymore. It could be either mat or, those surfaces where it kind of lets the water through. It's kind of like a grid, like they have a lot in the pools. So if it's really preventing the little puddle from forming, then I feel like it is removing the hazard. If it were something that is just like, oh, you put this floor covering to help out, but people can still slip, then it would be a policy and procedure if it's not completely effective. So it has to be like you were saying, it has to be something that like, you're not counting on someone to follow another policy or procedure. It's just from the get-go, you've prevented the risk.
Yeah, great. Thank you so much. Okay, perfect. So now that we have an understanding about the the kind of different ways that we can address hazards and that they are at different levels of effectiveness, with PPE or personal protective equipment that you wear on your body being the least effective, policies and procedures being kind of a mid-level option in the middle, and then the best option is going to be removing the hazard altogether and really thinking about what is causing the issue and then solving that. So now we are going to apply what we just learned to some scenarios. So Alejandra is going to tell us about Andre's story.
Okay, great. Thank you, Yasin. So I'm going to read Andre's story and then we'll think about what we could do for a situation. So Andre is a 17-year-old and he works in a grocery store. One day, while unloading a heavy box from a truck onto a wooden pallet, he felt a sharp pain in his lower back. Andre tried to keep working, but his back kept bothering him. So he finally went to the doctor, and Andre work had to miss work for a week in order to recover, and his back still hurts sometimes. He still has pain. So, what could we do to keep this injury from happening again? How could we protect Andre? And I'm trying to think of the three different categories. So, of course, the first thing we always want to consider is, can we remove the hazard altogether? So Yassine, can you think of any ways where we could make sure that he's protected by removing the hazard?
Yeah, definitely. So something that we could do is make sure that there is a weight limit on boxes. So if we know that um, boxes are going to need to be unloaded from this truck onto a wooden pallet, then we could limit the amount of weight in each box to make sure that it's an amount of weight that one person can comfortably get from the truck onto the pallet. Another idea is maybe if that's not possible, then to have like sometimes I've seen on boxes like a warning or like a an announcement that this box is really heavy, and so it could say like overweight box, and then that could be an indicator that um, like more than one person needs to lift this box at a time. And
Mm.
so I think that would probably go into our second ring on the safety bullseye, because there would, again, all those issues that we talked about. Is there adequate staffing? Is there another person that can help lift this box? So yeah, those are some ideas.
Yeah, those are really helpful. I'm wondering too. I mean, it depends on the situation, but sometimes there's little like carts or dollies or mechanical assistance, so that it's not like the person lifting the box, but you let the machine do more of the work. And then also depending on how things are laid out, maybe the place where maybe the way that the boxes are unloaded, they're closer to where they have to end up, so no one's having to take them from one place to another. They're already being delivered close by to where they're going to end up, maybe even like already in that space. That might also protect him. And I'm thinking, so we have some ideas about how he could not. I mean, the best thing would be is if he doesn't have to do the lifting, right? Because that's the
Mm-hmm.
hazard. And then the next best thing is like to do it as safely as possible, like either having someone help him out, um, maybe having training on how to position your body to lift safely. But then I know that in a lot of places they give out back braces. Is that a good example of PPE that would protect in this case?
So I'm so glad you brought these up. This is a really common misconception. So back braces are not they are not personal protective equipment. Um, they don't protect you from future injuries. And if you think about it, that makes a lot of sense, right? Because you can't like you can't put something on externally that kind of makes you stronger. But unfortunately, that's the idea that people have. I think it can kind of create a sort of false sense of security. And so sometimes when people put on those back braces, they feel like even stronger than they would be normally, and then they try to lift something that they might not otherwise feel like they could lift on their own, and then that could lead them to getting injured. So back braces can be really helpful if you have a back injury, and they can kind of limit like further strain, but they are not an example of personal protective equipment or any kind of, they can't prevent an injury in that way.
That's really helpful to know. So if someone is in a job where they have to lift heavy things, they shouldn't just ask for a back brace and feel like they're protected. They should actually try to make sure that they're not lifting things that are too much for them.
Absolutely, exactly. Okay, great. So do you have anything else that you want to add on Andre's story before we move on?
No, I think we've come up with some good ideas to begin with.
Okay, great. So now let's talk about Anita's story. So Anita is a 16-year-old barista at a small coffee shop. One morning, the coffee shop was short-staffed because another worker had called in sick. During the breakfast rush, Anita worked the register and took orders from customers while she also hurried to make a new pot of coffee. And she didn't realize that the other barista had already started a pot, and so she pulled out the brew basket while the machine was brewing, and boiling hot water and coffee grounds spilled all over her hand, causing second-degree burns. She went to the emergency room for treatment. Anita had to cut down on her day-to-day activities for 3 months, and she still has sensitivity in her hand and scarring from the burn.
Hmm.
Yeah. So, what solutions might have kept this injury from happening? And again, we're going to keep in mind all three levels of the bullseye of starting with the best option, which is removing the hazard, and then maybe some policies and procedures that could help the situation, could have prevented it. And lastly, thinking about what personal protective equipment might have been helpful.
Well, I guess when I think about how to, remove the hazard, it seems like the system they have going with that kind of machine is not very safe. So if the machine were such that it had, guards that you couldn't remove it while it was still, the hot water was still in there. So you had to wait until it stops dripping and then it unlocks and you can take it out. That would be one thing, maybe the design of the machine, or maybe if there's a way for her not to, it sounds like this was the rush hour in the morning. So maybe there's some pre-poured cups, of the drip coffee that are ready for people to take, or maybe even customers can dispense it themselves. They get the cup and then they can kind of pour it carefully. Of course, you'd want to protect the customers too and make sure it's a good design for them as they're pouring as well.
Absolutely. I love those ideas. If we're thinking, um, I think that those are really helpful because one of the issues here is the speed, right? And so this happens all the time, unfortunately, that workers are being asked to do so many different things and in like a really limited amount of time. And so that kind of like hectic, like quick pace can cause a lot of issues. And so in those solutions, right, if the customers can pour the coffee, if we've got a good design that makes sure that customers won't get burned, or pre-pouring the cups if we know that the morning rush is going to happen and we can have those cups ready. Those are both really great options for removing the hazard.
Yeah, one more thing with the design of the machine, it could, have a light that goes on when it's safe to take it out, or a sign. And I guess that if we start thinking about policies and procedures, I wonder if Anita was actually trained on how to use the machine safely and when to remove it. So that could be another policy, is to have good training, to know when is a safe time to take it out. And then like you mentioned, I mean, the another root cause here is that she's trying to tend to things. So she's trying to tend to customers and do the coffee. So if there was enough staffing that she could just focus on the cash register and someone else was just focusing on the coffee, then they would know, that they've already started it. She wouldn't be coming in kind of new to someone else's procedure. So maybe adequate staffing for someone to, be able to work safely with the machine.
Absolutely, absolutely. One other idea going along with machine design could be that the that it's not possible to remove the coffee tray while it's brewing, um,
Right.
or at, like in addition to kind of maybe having a light or some kind of indication that it's in process.
Yeah, I agree.
Great.
And I guess if we move to PPE,
Yeah.
gloves would be helpful for her. And then depending on, I mean, it could sure also looks like her arms are also bare. So she has an apron, but her arms aren't protected. So gloves and, long sleeves. I don't know how likely it is that it would splash in her eyes, but if that's happening, then, eye protection couldn't hurt.
Yeah, absolutely. And I think thanks for pointing that out about the apron, right? And so I think sometimes when we think about PPE, workers are just given kind of like a general, like, here are some gloves to use, without thinking like, okay, so if she was wearing plastic gloves or just kind of like the regular like latex gloves, those wouldn't protect her from the burn, right? And so we need to be make sure that our PPE is specific, and actually going to protect workers from the particular hazards that they're facing, right? So we can't just have one box of gloves and then everyone can just kind of use them for any different task that they're doing. If we're gonna be using PPE, it really has to be kind of specific, and all of those things that you mentioned before, right? Does it fit properly? Is it available? Is it, if it's really uncomfortable to wear, right? So again, kind of the PPE and the policies are introducing lots of potential issues that might make it difficult for workers to actually be made safer by them. But if we can remove the hazard altogether with some of those other options that we talked about, like redesigning the machine or redesigning the way that the work is done, then workers can really be a lot safer.
Yeah, I agree. And I think what I see a lot is that sometimes it seems easier to just buy PPE, and sometimes it's, a lot cheaper. And so, we don't ask the question of like, is that the most protective way? Because usually, like you said, redesigning the workplace, different equipment, like really actually removing the hazard takes a little bit more thought and maybe a little bit more investment, but it's absolutely worth it, right? To keep people safe.
Absolutely. Great point. Okay, so now we are going to apply these same ideas about how to eliminate hazards in the most effective way to COVID-19. So I'm going to turn it back over to you, Alejandra.
Sure. All right. So COVID-19 is an example. We have it. It's a very important hazard now in a lot of different workplaces. And so if we're thinking about the most protective thing, last time we covered, how the virus spreads. And so the main way by far, the biggest risk is other people. Since, they can be contagious even though they're not having any symptoms. So we don't know who it is that's contagious and who isn't. And also we don't have, vaccine, we don't have testing. So anytime you're around people, basically, you could be getting exposed. So the number one thing that employers can do to protect their workers is to have policies that actually allow workers to stay home. And so especially if they have symptoms or if they're in a high risk category, like they have a pre-existing condition, or if they've been exposed already, so they should be home. And to be able to do that, they need compensation, because many people, if they have the choice of, losing their paycheck, or staying safe, or not, they have to go to work, right? They can't afford to lose that paycheck, and they have to sacrifice their safety. So being able to stay home with pay, and also not fearing that they're going to lose their job as a result, right? That they know that they have a job to go back to. So no retaliation for actually taking the time that they need. And that includes not just their safety, but when they have to be taking care of others that are home, like children or other family members that are sick. And then, the next best thing is if you can't keep people away from each other, in like some of these essential industries, and as things start opening up more and more, there's, more and more businesses. So the next best thing is to at least make sure that people are apart. So, at least 6 feet. That way, if you remember what we talked about, the little infected droplets, it's harder for them to reach you. So physical distancing, and that can be, can take a range of forms, but it could be physical barriers or just markers for where people should stand or sit. And then also to have regular hand washing, because if you remember, the virus only enters the body through the eyes and the nose and mouth. So if you're able to keep your hands clean, then even if you touch those areas, you're protected. But for that, again, workers have to be supported to do it. So that means that they have to have time away from their duties to do it often, and they have to have the supplies like soap or hand sanitizer if that's not available, so they can do it regularly, because the key is regularly. It's not just like at the end of the shift, because you never know when your hands are contaminated. And then next would be, this would be another policy and procedure, is, cleaning and disinfecting regularly, even though, contaminated surfaces are not the main way that the virus spreads. It's just a precaution, a safety precaution, so it doesn't end up on people's hands, and then that goes to their eyes and nose and mouth. So, again, the time and the supplies, and also the training to do it safely, because the chemicals that are used are a hazard in themselves. And then lastly, there's PPE. There's not really very effective PPE against a virus, short of, actual respiratory protection, such as an N95 mask, or things that are even more protective than that. And so since right now, because of the shortage, that's reserved for healthcare workers, what they're advising is the cloth masks for when people can't distance. And that can be helpful, to contain that person's droplets from spreading, but it's not PPE in the sense that the virus still goes through the mask. So, if you cough or you talk, your droplets, some of them are still getting through the mask. And then when other people breathe in, those droplets are still getting through their masks. However, it can cut down the number of droplets that are spread. So, it's still advisable, but just I think it's important to remember that we don't, outside of the healthcare setting with N95s and other respirators, we don't really have good PPE. The rule for the gloves would be if you can't wash your hands often, then the gloves can be kind of a good reminder that your hands can be contaminated, and it keeps you from touching your face as much. But again, you still have to remove them correctly and make sure you wash your hands right after.
Great. Yeah, I think that that is such an important point with the PPE around COVID-19, because I think that, like we were just talking about with the barista example, sometimes there's this idea that like, oh, it'll be easier to give everyone PPE, but I really appreciate how you laid out the limitations of this PPE, right? That the virus isn't kind of coming through people's hands. And so if they're wearing gloves, but then they're touching their eyes or their nose or their mouth, right? Or so something that we've heard also is if people are wearing cloth masks, that they slide around, right? So if you're wearing gloves and a cloth mask and then you've got germs on your gloves and then you're messing around with your mask to try and get it to stay on, that is potentially dangerous, right? Whatever's on your gloves could get on your mask and your mouth. So I think that's a really important point. Thank you for walking us through that.
Yeah, and just a really practical implication is, right now a lot of unions and worker advocates are really, trying to get better protections for workers. And so what we've covered with the bullseye, right? If your go-to is like, well, just give everyone masks, and that's your ask for the employer, you're not really protecting workers very much, because masks do not protect against a virus. They help a little bit, but they're not protective, nor are gloves, as you just explained. So it's really helpful to think about what will really remove the hazard, right? And it's going to be keeping people apart, whether, not in the same space at all or physically distant, if they do have to be there, and then the other policies that we talked about. So it has very important implications for making sure you're fighting the right fight for workers.
Absolutely. Thank you so much. Okay, so now getting back to workers, it's a perfect segue. So now we have Julia's story.
All right, so Julia, this is a story of a grocery worker who, they've been essential workers from the beginning, and actually are having really incredibly high rates of infection of COVID-19. So Julia, for the past few weeks, the grocery store has been extremely busy. She sees over 300 customers a day, which is very typical. Julia and her coworkers have been working quickly to help customers and to restock shelves. The distance between the cashier and customer, and between the cashier and the person bagging, is about 3 feet. So definitely less than the recommended 6. And customers mostly bring in their own cloth bags. So let's think about, for Julia, how could we protect her in the situation? And these are the categories that we just went through, right? So number one, how can, supporting workers to stay home if you're sick, the physical distancing, cleaning and disinfecting the work site, regular hand washing, and personal protective equipment. So what would you say, Yassine? Do you think there's a way what would be the most protective solution for someone like Julia?
Yeah, definitely. So I think that something that I've seen some stores do that's really helpful is to have people submit their orders online. And so the only people who are in the grocery store are the workers. And so there'll be a lot more space, right, for thinking about physical distancing. And then they can collect those items and bring them outside and kind of leave them for the customers to pick up. So that's one way to really limit the number of people who are inside the store, to make the physical distancing possible. Another thing that we've seen stores do is kind of have someone outside monitoring the number of people that are coming into the store at a time. But in my experience so far, that is only partially effective, because once people are in the store even if there are like markings on the ground to say like, please stay 6 feet away. People, you know, are busy and they're in a rush, and they're kind of still having to really move around each other in the aisles. And so it's really difficult to kind of keep that 6 foot distancing when you have people in the store, even when the number of people is limited.
Yeah, that's a really good example of what we were talking about before, that you can have a policy that could be a good policy, but it doesn't mean that it'll be followed.
Right,
Yeah.
exactly.
Yeah, so let's I guess let's we have some examples here of how it would apply for the bullseye, right? So to eliminate the hazard, you know, like we said before, for Julia is for her to be have paid time off, right? Especially if she's been exposed to someone, like let's say one of her coworkers ended up testing positive and she knows she was in close contact with this person, or she's beginning to have symptoms, right? Or she is very vulnerable because she has a medical condition. So all those, you know, she should be home. She shouldn't even be there in certain circumstances. That would eliminate the hazard for her. And, you know, obviously again, with no retaliation and pay. And then if we think about some policies and procedures, let's look at some examples of that.
Yeah, so this was sort of what some of the examples that I just gave were really in the policy and procedure example of like how are we interacting with kind of, if the store has to be open and if employees have to be there, then what policies or procedures can be put in place to try and keep workers as safe as possible.
Right. And you know, one note, like you can see in the picture here with those plexiglass barriers, I've noticed that a lot of them, they're not really adequate. They shield like a little bit of the space, but then when you get to the part where you're paying, it ends. And so people are face to face again. So that's the other thing too with you know, with policies and procedures, is that it has to actually be the right the right thing to the right extent. Otherwise, if there's a gap, right, then you're not really being protective.
Right. And then something I've noticed also with the plexiglass is people kind of like moving around the plexiglass
Yeah.
block to the
Yes.
cashier, which is like really just you know, defeats the purpose.
Yeah, and also, I mean, the obvious thing too, that you know, the little particles can float up above and
Right,
around,
right.
and the other side, you know, just like with the mask, the particles can escape through, you know, all around because it's not really sealed to your face. So
Mm-hmm.
yeah, these
Exactly.
are all helpful, but you know, they're not going to eliminate the hazard. They're just going to hopefully reduce it. So let's keep going to the next category, cleaning and disinfecting. And so I think this is an area where we've seen a lot more progress, right? Where there's regularly scheduled times to disinfect. I mean, ideally, again, this wouldn't be added to people's workload. There would be, you know, some stores, for example, are opening later and closing earlier so that staff actually have time to do this extra cleaning. Some are hiring extra staff to do it. So all the commonly touched surfaces, and then, you know, to have actual breaks, additional breaks to do the hand washing um, as well. And you know, one other point to say on that is that remember that, you know, when you protect a worker, you're also protecting everyone in their household, right? Or everyone that they're going to come into contact with, because they could be bringing the infection home to their house and to their community.
Right, absolutely. And just another example of why that paid sick leave is so important, right? If like we know that grocery workers are being are getting the virus at really high rates, and so if they are being made to still come to work, then if we think about all the people who they're coming into contact on their way to and from work, like we talked about in our first session, and their families, like you just mentioned, and all the customers that they are coming into contact with if they haven't if the store hasn't implemented those policies. And so when we're thinking about worker health, we're also thinking about public health in general, right? And so when we do a really good job protecting workers, we're also doing a really good job of protecting everybody else.
Yeah, that's a great point. And so, the same way that workers will impact public health, you know, the public, I think it's really important too that we need to make sure that the public is protecting workers. So, for example, with the mask wearing, the cloth mask wearing, some customers refuse to do it, and they're not, they're deciding about the risk level for them, but they're actually putting the workers in the store at risk, right? And so, or if they refuse to stand in the markers, or to put their face in front of the cashier, where there's no plexiglass or around it. So it goes both ways, right? So workers can be contagious for the public, but then also the public can be, a risk for the workers.
Absolutely, absolutely. And I think that it's so important, right? Like if we're thinking about all those different hazard categories that we were talking about, like it would be so stressful to be of course, for any essential workers who are working right now and they have so much on their mind and they're at this high risk, right? And then to have to deal with customers that aren't following the procedures at hand. And then also we've seen reports, right, of violence that has occurred, customers that have gotten like really belligerent and aggressive. And so we're thinking about those different hazard categories of like the stress and the violence and like the virus itself. And so workers are really are like living through such a difficult time right now. And so kind of focusing on our safety pyramid and eliminating the hazard with paid leave is really the most effective way to handle the virus.
Yeah, I agree. All right, so then for PPE, as we mentioned before, gloves may be helpful, just more in the sense of reminding yourself not to touch your face, being aware when you're doing it. And for this, you should, like you were saying, Yassine, you should make sure you're using them properly. Actually, it's recommended for some people, latex can cause allergies and also asthma. So maybe using non-latex gloves, and if they're meant to be disposable, you should be disposing of them at the end of each shift, or if they're damaged, then before that as well. And we're not even listing cloth masks here because, as we discussed, they're not actual PPE. They don't actually protect against the virus. They lessen it a little bit, but the virus goes through the cloth. It's not made to keep the virus out completely.
Great. Great. Thank you so much for walking us through all of these examples.
Sure.
So now we're going to move into our next section, which is worker rights. So this is a really important point, that when we're talking about all of these issues about health and safety, all these different hazards that workers are being exposed to, it's really important to remember that employers have the legal responsibility to provide safe workplaces. So here on the screen, we have Section 5A of the Occupational Health and Safety Act, which says basically that all employers have to provide an environment, a work environment that's free from recognized hazards that aren't going to cause death, physical harm to their employees, right? And so this isn't just like a nice idea that employers like, oh, it would be nice if they could do something for their employees. No, this is actually the law, and we know COVID-19 is absolutely a recognized hazard, and so employers have the legal responsibility, and then kind of the flip side of that is that employees have a legal right to safe and healthy workplaces. So if we kind of dig into that a little bit deeper, what must employers do to protect their workers? So what they have to do is similar to kind of this process that we've been going through in our session today, right? So we started out with identifying hazards. That's what employers need to do. They need to identify the hazards and how workers might be exposed to them. They need to develop methods of control, methods to control and reduce the exposure. So again, thinking about the safety bullseye, that the most effective way to control a hazard is going to be to eliminate it altogether, to just keep it completely away from the workers. And then this third point is training workers on new hazards or work duties and how they can be protected, right? And so this is, I think COVID-19 is such a good example of this because it's a new hazard. This is something that we weren't, like, of course there have been infectious diseases, other kinds of infectious diseases that have been around, but COVID-19 specifically is something new. And so we can see here that workers have a right to this training to find out, okay, like how am I going to be protected at work from this new issue or any other kind of issue that comes up.
And can I ask you a question about training? Because I think,
Mm-hmm.
with something I hear a lot from workers is that they're given, a 5-10 minute little speech before they're sent off to work, and that's it. That's the extent of the training. Or sometimes that, not even that. Sometimes they're just given a paper to sign to kind of say, that they've been trained when they haven't. And then often there's language issues where the workers don't. The information being given to them is not the language that they understand. So how like what does it mean really to provide training? What's the obligation of employers to provide training that's
Yeah,
clear?
thank you. Yeah, thank you so much for bringing up that point. So employers need to provide a practical training, that it needs to be in a language that the worker speaks, like understands. And so it doesn't necessarily need to be like a written training if there are literacy issues, but it definitely needs to be in a language that the worker can understand, right? And if we think about that, that is like such a bare minimum level, right? Like how could you be expected, how could a training that you can't understand that's being given in a different language protect you at all, right? That doesn't make any sense. So it needs to be more than that. And I think that there are lots of really great examples of unions and worker organizations that have found, have created train the trainer programs and really had workers be the ones who are kind of employee, this is the employer responsibility, but if you can learn from a peer leader and have something practical, right, where you are actually getting to like try out these different ideas. So to kind of take it from just kind of like you mentioned, like signing a form or kind of like a 5-minute speech or maybe like watching a quick video, that's not actually helpful. It's going to be much more helpful for people to be able to practically apply what they're doing. And so if we're thinking about something like ergonomics, right? How do you actually like lift something? Or if we, like in our example with Andre earlier with a heavy box, right? If there's a new machine that's introduced into the workplace so that Andre doesn't have to lift those heavy boxes, then he would need training on how to use that machine safely.
Yeah, that makes a lot of sense. It would be really hands-on and really meaningful.
Yeah, great. Okay, so now we're going to do a little Q&A around basic labor rights. So Alejandra, do you know what the minimum wage is in California? Is it the minimum wage that people need to meet their basic needs? B, the suggested minimum that employers should pay their workers? Or C, the legal minimum that employers have to pay workers?
Well, I wish it were A,
Yeah.
so that everyone could meet their basic needs. But I know that the answer is actually C, the legal minimum that employers have to pay workers. So it's not suggested, it's actually the law. And one thing to keep in mind about the minimum wage is that it's changing all the time. So this is the minimum wage for California as a state, and you can see that different years that it's going to be going up. And also there's a distinction between kind of larger businesses that have 26 or more workers, and then those that have 25 or less. And so even though California has a minimum wage for the state, which means, anywhere you are in the state, you can't be earning less than this, right? That's the minimum that you're supposed to get. But a lot of different cities and localities have passed an actually a higher minimum wage than the California state one. So, for example, Oakland is at 14.14 right now, and many others, San Francisco and San Jose, and many other places have higher minimum wages, and that's because they know that the cost of living is much higher, and so worker advocates have been able to fight for a little bit higher wage, and often it's still not enough, but I think it's a recognition that the state minimum wage is definitely not enough for most places.
Absolutely. Okay, so our next question. When do employers need to provide rest breaks? Is it A, at least every 2 hours, B, at least every 4 hours, or C, when it's not too busy?
Well, I hear C a lot from employers. You can take your break when the restaurant isn't so hectic or something like that. And actually, sometimes the break happens, early into the shift. So I know, though, that by law, it should be B. So it should be at least every 4 hours. So, if the employer wants to give the break earlier, that's fine. It's not a problem to give the break earlier. It's just a problem to give the break later, because 4 hours is a long time to go without a break. So after 4 hours, you shouldn't be working anymore without your break. And in the law, it says that the break needs to be at least 10 minutes, and it's paid time. So, your employer can't deduct for that time. And there in California, we have a heat illness prevention law that actually has details about, depending on what the temperature is outside, when it gets really hot, then workers have a right to have more frequent breaks, so kind of preventative breaks, so that they don't develop heat illness. And they also need to be able to take their breaks in a shady area and have some cool water.
Absolutely right. So this picture is very different than that hazard picture that we were looking at earlier, where all those were crowded together and working, and there was no shade or water in sight.
Exactly. And you want to take the break before you're sick and have symptoms, not after.
Right, of course. Okay, next question. When do employers need to provide meal breaks? Is it A, 3 times a day, B, exactly halfway through the shift, or C, at least every 5 hours?
I am going to go with C, which is at least every 5 hours. And it's similar to the rest break, what we talked about. If they provide the meal break earlier than that, that's fine. But if you're working 5 hours, then you need your meal break. You can't be working any longer than that without your meal break. And just to keep in mind, if you have a really long shift, let's say your shift is 12 hours, then you might need more than one meal break. It's important too that the break it should be at least 30 minutes, right? So, and you need to be off duty, right? So you can't be like, well, eat your sandwich while you answer the phones or something like that. Like, you should be off. And this time does not have to be paid. It can be, but it doesn't have to be by law, but you just have to have that time to eat.
Absolutely. Great. Thank you. And then something else, just thinking about like the COVID-19 example that we were just going through, right? If workers are being expected to, or kind of being asked to do work while they should not be because they're on their rest break, right? If you're answering the phone and trying to eat, think about like all the germs that are on your hands that are now going to be near your mouth as you're eating, right? And so again, it's really important to kind of like have a break. And like in this picture, we see it looks like people have a break room that they can go to. There's going to be a sink. They can wash their hands and sit down and eat properly, and then kind of go back to work. So there's also that that kind of extra exposure potentially if people are kind of working as they're eating, when we're talking about like hand sanitation. Okay, so number 4, which of these are employers' legal responsibilities? A, they have to have a plan to identify and address hazards. B, they have to have workers' compensation insurance. C, they have to train workers on health and safety before they do a new job or task. And D, all of the above. I should say, or D, all of the above.
Well, all of those sound like very important things, and they're actually all legal responsibilities. So definitely D, all of the above. And this is, of course, not, the be all and end all. There's other legal obligations that they have. They're not all listed, but those are really important ones. And another one that's really important is protection from retaliation. If you either report hazards, if you bring up your health and safety concerns, or if you report that you have an injury or an illness because of work. So your employer cannot legally, retaliate against you for those things.
Great, thank you. Okay, how many hours of paid sick leave do workers have per year in California? A, none, B, 24, or C, 100?
Well, for a long time, it was actually none. But a few years ago, we actually got a law in California that says you have 24 hours per year. And so there's some really good aspects of this law. I mean, it's not nearly enough time for sure, but there's some flexibility in it, which is helpful. So, roughly you're at about an hour for every 30 that you work, and you can't take it right away. You have to be with the same employer for 90 days, and then you're allowed to take it. Of course, the employer can choose to let you take it earlier, but this is just what the law says. And the other great thing about it is that, you can plan in advance. So if you know that you have a doctor's appointment or you need to accompany, your parents or your child, you can schedule it with your employer and let them know. And they can't ask for like a doctor's note to prove, where you were. And it's meant for you to take the time for your health, but also for others that, may depend on you. And you don't have to take like a whole day off. It could be, you may need, let's say 4 or 5 hours, and that's fine. You could just take it in smaller increments.
Great, thank you so much. Yeah, and then as we were talking about before with kind of removing the hazard of COVID-19, if people are staying home from, like, to keep workers safe in this environment, 24 hours is really inadequate, even though it was, like a struggle and a win to get to this point from 0 hours up to 24 hours. There's so much work to do, right? To kind of have employers actually keep workers safe, especially in this current context of COVID-19, to have paid sick leave where they can be home.
Yeah, absolutely. So this is a little booklet actually that has a summary of the basic labor rights, and you can see the link to where you can find it online at the bottom. It's in 5 different languages, and it covers minimum wage and overtime, meal breaks, rest breaks, health and safety, workers' compensation if you get hurt or sick on the job. That is an employer's insurance that covers you for that. And then also your right to be protected from retaliation. And for all of these things, if you are facing that situation at work, there are ways that you can have those rights be enforced. So this gives you information about like where to call, which government agencies are in charge, where you can file a complaint, all those things.
Great, that sounds really helpful. Also on our website is this worksheet, a fact sheet called Are You a Working Teen? So there are special rights for workers that are under 18. So child labor laws have restrictions that limit work that is likely to hurt workers under 18. So this is really important because young workers, which we define as workers under the age of 25, are actually twice as likely to be seriously injured at work than workers that are older than 25. So that's why these laws exist. And so they include things like limiting working hours, especially like during the school year and on school nights. And those hours are different in California if you're 14 or 15 versus 16 or 17. And then also there are limits or like prohibitions that folks under 18 aren't allowed to use certain dangerous machinery, right? So like that meat slicer we saw in an earlier example, and then also limit tasks like driving. So there is a ton of information in this fact sheet, and you can find it at youngworkers.org. And learn a lot more. We also have a work permit quiz on there so that you can kind of test your knowledge once you go through the fact sheet.
And Yassine, why is it that young workers get injured at a higher rate? Is it just that they're not being safe?
No, that is a great question. So there are lots of reasons why, right? If we think about young folks that are coming into the workforce, right, this might be their first job, and so they need to have training and support, and they might not have experience kind of navigating workplaces, and that assumption isn't kind of always understood. Another thing, there's been a lot of research done on this actually, and another thing that comes up often is that young workers are really eager to do a really good job, and kind of are often like jumping in to prove that they can do things, and kind of really want to do a good job. And so it's really important for employers and parents and teachers to kind of come together and be able to make sure that young workers have the support and training that they need, and also to really encourage young workers to speak up about when they have questions, or when they see things that aren't safe, right? So sometimes what we see in workplaces is that there's kind of like a procedure or a way that people do things that isn't safe, but that's just kind of the way things are done. And so if a young worker is coming into that situation, and that's kind of like what's being modeled for them, for them to know their rights and to be able to speak up and say like, hey, actually that doesn't seem safe, or like, is there a different way we could do this? And so we have a whole young worker training program that is focused on kind of giving young workers those tools of what are my rights, how do I identify hazards, what are the best ways to solve those hazards, and how can I speak up to make my workplace safer and healthier.
Thank you. I think that's so helpful that you explained that.
Sure. All right. Well, this is the end of our recording here. So thank you everyone for joining us. If you are joining us, then now please go ahead and click the link to our post assessment, so we can see how effective this was, and let us know if you have any suggestions or feedback. And then here also we wanted to include our email addresses. So if anyone has any questions, or they kind of need help with some resources or experiencing something at work, please feel free to reach out to either Alejandra or myself. And then lastly, we just have our website up here, which is www.lohp.org. And thank you so much.
Yeah, and I'll just add that for our website, we have a section that is on COVID-19 resources. So if that's something that you're facing, or people in your family, your community, we have a lot of information about how to stay safe. Some of it is specific to different industries, some of it is in different languages. So check out those resources if you're needing them. And thank you again.